Hello, friends. Good morning. First of all, apologies for not being with you in person live. I thank Samiksha, Sandhya, and other team members for giving the opportunity to be talking to you today. Now, I just want to give a perspective of what all it's about, and pediatric oncology. That means childhood cancers. Have really paved the way how cancers are treated over the decades. What used to be a universally fatal cancer, that was childhood cancers of various categories a few decades ago, have now really been possible, to cure them. And we know that about 75 to 80% of the cancers now in childhood cancers can be cured and cured forever. However, as we embark on the treatment of these cancers, which ranges from few months to few years of treatment, there's a huge cost which the children with cancer and their families have to pay. To name a few, it brings with it a lot of financial burden, burden of staying away from their probably their towns and cities and moving to a different city where the pediatric oncology units are there to treat them. Burden of job loss, from the family members and the breadwinners, and also more importantly, the psychological and the emotional strain, not only for the kids who are undergoing these treatments and these cancers, but also to the extended and the immediate families. We must have heard so many instances of um, you know financial empowerment with the treatments, with the cancer treatments, parents losing jobs, and various other stories which these cancer treatments bring along, which and most of them are very unpleasant. Now, one of the important aspects in this whole journey of pediatric cancer also is the loss of school days, the interruption in the education of these children, and that although is a very important aspect, but unfortunately has been neglected in our part of the world, and especially in the developing countries. Now, the developed world in the West, there's a lot of emphasis on the aspect of education, both formal and informal. While the cancer treatments are going on for the children, and there are structures in place which addresses these concerns. It has been a huge unmet need in our country, and I'm so glad that Samiksha identified this unmet need, and have been very very active in this field for so many years now, and helping children to continue their education, which is formal, but also a lot of informal education, which is imparted to the children while they are undergoing the treatments, and kind of bringing this to the doorsteps, while they're in the hospital, where they're out of their hometowns, living somewhere else. And even now recently, with the COVID epidemic, it has even taken the shape of a remote learning, where you are wherever you are, but the teachers and the volunteers from Samiksha would try to keep their education going through remote learning applications, and the gadgets which are been in use for the last few months now. So it's a great contribution to this unmet need, which Samisha has addressed. I'm really thankful to them. And it's very difficult to kind of measure this contribution and the impact it has made. But being one of the persons on ground, dealing with the children and the families, I would tell you that this has really made a huge contribution in their development. And also inadvertently, what it does is that it also with the helps the families and the patients to overcome these treatments and the burdens which comes with it better. It's a psychological emotional support to them during this phase, and that's another component which Samiksha brings along through its volunteers and through its organization. So today, as we know that there's a scholarship giving day, and a lot of the children who are now in the higher classes and require financial support for continuing their education, and that's another feather in the cap of Samiksha last few years, and they've been helping hundreds of children to continue their education with whatever small financial help they can provide through these scholarships. And I thank them for taking this up, this unmet need, identify the unmet need, taking this up, and also reaching out to these children and families to help them to continue their education so that they can become the meaningful members of the society in the years to come. So thank you very much, and God bless you.